So welcome back to another lecture in the Canadian healthcare system. Talk now about the Canadian healthcare system, And we have some points to talk about, like the Medicare, the Traverse Canada's publicity-funded healthcare. Instead of having a single national plan, we have 13 provincials. So in Canada, there is 13 provincials and territorials healthcare insurance plans. There are 13 healthcare insurance plans, which show us a kind of diversity in the plan itself. And the rules and responsibilities for the health plans share between provincials and territorial governments and the federal governments as well. We will talk also about the provincials and territorial governments are responsible for the management, organization, and delivery of healthcare services for their residents. We'll talk about the field of government. The federal government is responsible for what? The federal government is responsible for setting and administrating national standards for the healthcare, providing funding support for provincial and territorial healthcare services areas, supporting delivery for healthcare services to specific groups, providing other health-related functions. So the federal government here, the Canadian federal government is responsible about 3 points: setting and administrating national standards for the healthcare system, providing funding supports, fundraising with money, and finally, supporting delivery of healthcare services to specific groups in the community or the Canadian community. So what about the Canadian Medicare principles? What are the Canadian Medicare principles? And this is a very important question. What are the Canadians Medicare principles? And I see you guys can see that this question is very important here. I'll just enlarge it so that we can see it properly and it will be clear for us. Here it is. So the first one is the comprehensiveness. The insurance plans must pay for all. The comprehensiveness means all medical necessary services. In a hospital, all necessary drugs, supplies, and diagnostics tests are covered. A range of necessary services provided outside the hospital are also covered. So it's not only in the hospital to be covered, but also out of the hospital. This is the comprehensiveness. The first thing means that all the health services must be covered. Universality, universal. Every permanent resident of a province or a territory is entitled to receive the insured health care services. So if you are on a PR, on a permanent residence, and you are entitled to take all the medical services like any Canadian. No difference between a person who's immigrant and the Canadians regarding the healthcare services. So same care on the similar terms and conditions. Third thing is probability. People can keep their healthcare coverage even if they are unemployed, change jobs. What in the case? The probability means what if the case was, I don't have job, I'm not working, I'm changing my job, I'm relocating from one place to another place or from province to another province. So in all these cases, still you can keep the healthcare. The healthcare is guaranteed to be afforded by the Canadian care system or by the Canadian healthcare system. However, if they are moving, it is their responsibility to inform the province or territory and to get registered. So if I'm moving from Toronto or Ontario into another Alberta or whatever, then in that case, or Quebec, in that case, I have to inform the province there that I newly moved here, and so that I can be eligible to apply the service to gain the healthcare service. Accessibility, people can receive medically necessary services regardless of their income. So the accessibility means everybody is accessible to it. Everyone will take this medical services, will take this healthcare services. No one is having the superiority or the favor instead of another one. No, all the people are equal here and all have the same services and get the same services. Fifth, public administration. The insurance plan must be run on a public organization on a non-profit basis. So public administration. So it must be public organized, and non-profit organizations are the one who's doing this. It's not a profit organization because actually this work, healthcare, should not be a profiteering work. This is not a private school or private college or private hospital. This is a government work, and the government is responsible about affording the healthcare services to everyone who is in need to it. Must be accountable to the citizens and the governments of the provinces or territories as well. So these are the core or the basics of the Canadian healthcare system, These are the basis of it. And we have to put a question here right now. And I will go here right now. And I will just put new slide. And I will say what or list the, and here is the question, Canadian Medicare principles. Canadian Medicare or healthcare principles. List. This is my question. And I will wait here a few minutes for you guys to get the questions answered. And I will wait here for you a few minutes to get this question answered. List the Canadian Medicare principle. List the Canadian Medicare principles. And also, we can get use of this also as well. First of all, here it is in a figure, and I think in a figure looks better and looks more comprehensive. It's a public administration. All administration of provincial health insurance must be carried out by a public authority. Like we said before, it's non-profit work. It is public means non-profit work. Comprehensive, all necessary healthcare services include hospitals, physicians, and so it doesn't go for some exceptions. Comprehensiveness means that it goes for all the healthcare topics or the healthcare issues. It doesn't go for something. As example, you don't go to see the X-ray for money. X-ray is free, or MRI is free, and so on. Medications, all the prescriptions free, and so on. So this is how it works. I mean, doing a surgery in a hospital is a free. If you do it in all the healthcare services are totally free. This is a comprehensiveness and doesn't go to part of them and other part for money. No. Universality, it means that universality. It means that all are the same. No difference between a citizen and residents. All take the same, get the same service with the same quality in the same time. Portability means that if you move from one province to the other province, same likewise in the other province, you will take the service as well. You will have the services. Accessibility, everybody who has entitled for the healthcare service can get this service. This is the meaning of accessibility. So this is the main things. which we see here. However, there is still there are problems regarding facing the healthcare system in Canada. Many factors challenge and persist the Canadian healthcare system. These factors include severe shortage of physicians. So, one of the problems which is facing the Canadian healthcare system is a shortage of physicians or doctors, nurses, and other healthcare workers in rural areas. Some places people don't like to go there. Like, for example, the territories of the northwest, or some places which is rural areas, not very civilized, like Ontario's area, Toronto, and these areas. No, less people are there, so people don't want to go and work there, or they are rare there by chance. Second, the aging of the baby boomers generations. This is the second thing. Third, long waiting lists of patients, long waiting for the service. For the steadily rising cost of care, because now the cost itself, the healthcare is costing, and this cost is increasing right nowadays. And the new technology, which is the greatest challenges as well. This is also another thing. We can see here how far, where is the Canadian healthcare system into the other countries. As the example, UK, this is Australia, Netherlands, and here we go into Switzerland, and here we go to Germany, then Canada, then France, then the US. You can see now. This is higher performance, and here when you go down, lower performance. So the higher performance is the UK here, as you see here, UK. And we go all the way down, Canada in the lower performance, or let's say in the middle of the performance itself, but less than Canada is France and the United States of America in affording the healthcare services. Yes, it's facing challenges and it has its problems which affect about its own performance, that we see Canada here is not on the top of the scores in the healthcare service performance. We see that Canada is almost before two other countries that are France and United States of America. And it's moving towards the lower performance because of the waiting lists and those problems which we can see here: shortage of physicians, nurses, healthcare providers, the shortage, and the aging of the baby boomer generations, and the long waiting lists and the steadily rising cost of care. The costs are going higher, and this is causing another challenges. Right. Everything has its pros and cons. Everything has its pros and cons. So we have also pros and cons in the Canadian healthcare system. There is pros and cons in the Canadian healthcare system. So what are those pros, advantage and disadvantage of the Canadian healthcare system? Let us see what is it about. What's it about? Advantages: access to universal healthcare, the accessibility, like we said before, accessibility to healthcare. Everybody is eligible for the healthcare services. Reduce out of pocket expenses. This is the second thing. Because the Canadian system make it for no cost, like, because it afford a lot, a range of medical services without having to pay, because we don't pay to it. As Canadians, we don't pay for the healthcare. Promote social equity, so no difference between the people and each other, all have the same. They all have the same accessibility into the, all are accessible, having the same to access into the healthcare system in Canada here. No difference between a resident and a citizen. All are the same and all enjoy the same services, healthcare services as well. But though we have advantages for the healthcare system in Canada, still also there are many disadvantages for this healthcare system as well. The first thing is the long waiting line. The long waiting line, you can see here, there is a long waiting line. Long wait time for the medical procedures. Sometimes, as example, in surgery, in the minor surgeries, you have to wait for about 4 or 5 months till you get this surgery done. Shortages of the healthcare providers, that's another problem, especially in the rural areas, like what we said before, there is the healthcare providers are less. Lack of investments in cutting-edge medical technology and treatments, like anything need budgeting. Also, the healthcare need budgeting, especially when it comes to obtaining the new technology, since this technology has to be planned and it need to allocate financial resources, and that sometimes is not an easy target, is not an easy task for some societies and some communities. One of them is also encountered here in Canada. It's a problem as well here in Canada. So we said here that we have advantages and disadvantages regarding the Canadian system healthcare. This is another point I just want to refer to. So nothing is complete, everything is incomplete always, anything and anywhere, and this is one of the points. So we have 5 criteria for the Canadian Health Act that are comprehensiveness, universality, portability, accessibility, and public administration for any one of the provinces and territorials to have these services or to get the plans, to get the insurance plans for these services. Canadian healthcare future about the e-health, fewer hospitals, senior care, and the private insurance. These are some of the challenges which is facing now the Canadian healthcare system. The e-health, fewer hospitals, senior care, and the private insurance. So the Canadian healthcare system or the health insurance is covering 10 provincials, 10 provinces, and 3 territories. It's covering 10 provinces and 3 territories. This is what is inside the healthcare services in Canada here. One thing more I just want to say here. One thing more before we move into the next thing, we will have to stop and go back to have 2 questions actually. We have 2 questions actually here. This is the Canadian Medicare principles. Then also we have the second question. I will put the second question. What are the advantages and disadvantages or the pros and cons of Canadian health care system? So I have 2 questions here actually. The first question is the principal Medicare, the Canadian healthcare principles, which we said they are here in front of you here. Those are the 5 principles: public administration, comprehensiveness, universality, and portability and accessibility. And the performance, we said we saw have some challenges. Like, what are the advantages and disadvantages? Here we cover it in this part. The advantages like accessibility, no cost, at no cost, for everyone, where there's social equity. But the disadvantages. Hello? Hello? So this is the advantage also and the disadvantages. And here we go back to our questions. List the Canadian Medicare principles and what are the advantages and the disadvantages of the Canadian healthcare system. Shall say here like around 5 minutes. Please make your answers for these two questions before we move into the next part. Shall wait here like around 5 to 10 minutes for you to get these questions answers. The Canadian Medicare principles. Then the second question, what are the advantages and disadvantages of the Canadian healthcare system? Thank you. So here, back to track, and these are two questions which we had. Again, the Canadian Medicare principles, we talk about this, the public administration, comprehensiveness, universality, portability, and accessibility. And we talk also, we said there are challenges is going on. There is a severe shortage of physicians, nurses. We have the aging of baby boomers generation. We have the long waiting lists. And we have also steady rising costs of care and due to the technology. We said also we have advantages and disadvantages for the Canadian healthcare system. The advantages is access to universal healthcare coverage, reduces the money because you don't spend money for the healthcare. And there is social equity between the people. Everybody is having entitled and eligible for the health, getting the healthcare services. The disadvantages, uh, are the long waiting line, a time period. You have to be waiting a long time before you get the services, shortage of healthcare providers as well, and lack of investments in cutting-edge medical technology. Because like any other technology, it has to be budget and it has to be there must be resource allocations and plans for this obtaining this new technology, especially in the Medicare as well. We said also that we have 10 provinces and 3 territories, and they must be entitled for the services if they have the 5 principles which we talk about. We talk also about the future of the healthcare services in Canada, and we said this future of the healthcare services will be regarding the e-health, the electronic health, and the fewer hospitals and senior care and private insurance. Shall come here to the end of this part, then I will move to the next part. Thank you so much. Thanks, my dears. Thank you so much.